Found it. Alright. For those of you looking for the second part of this video, I do apologize for the slight delay in getting it to you. We've had a lot of technical difficulties, but everything seems to be set now, and I'm Dr. Brian Langlois. I'm the medical director here at the Main League of Lancaster County. In the first part of this whole segment on inappropriate elimination, I did talk a little bit about the causes of it, certain things to look for, certain things to watch for in your pet, specifically your cat, obviously, in this case. In this section, I want to talk a little bit about ways to help kind of correct the problem of inappropriate elimination and things you can try, things that might work, things that might not. And I usually preface this anytime I talk to a client about this is something that usually is not going to get fixed overnight. It's not some magic bullet. There's various things that people can try to do to try to make things better, but every situation is very case specific, so you want to be very careful in understanding that and realizing that you're going to need some trial and error, some trying some different things, and to really try to gut it out and stick it out. Vets are there to help you, shelter staff is there to help you. Really try to keep, obviously your cat in your home so you don't have to resort to surrendering it. So let's deal with some of the first ones that are actually pretty easy, and the first one obviously is getting your pet spayed or neutered. Obviously intact male cats, aside from the horrendous smell that's created in their urine, obviously are going to be biologically driven to mark. The testosterone and the hormones are telling them to do that. It's a natural response in their case. So obviously getting your cat spayed or neutered should decrease the marking that's going on by a fair amount. And remember, you can always tell a cat is more marking than having, just inappropriate eliminating by what they're urinating on. If they're urinating usually on the floor or on a horizontal surface, it's more of just inappropriate elimination, not so much marking. If they're kind of bagging up the vertical surfaces and peeing on the vertical surface with their tail kind of flicking a little bit, that's more of a sign of behavioral marking. So it's important to realize that with your cat so you can give the proper information. The second issue that sometimes is a little bit easier to correct is medical issues. And we always say this: if you have a cat that is suffering from inappropriate elimination, no matter what it is, urination or defecation, you want to get it to a veterinarian first. You want to make sure that you can rule out any kind of medical causes, because I guarantee you, if you work through all of this stuff and try to get behavioral things fixed when it's really a medical problem, you're going to be right back at square one, and you're really not going to fix anything. And you could potentially miss something actually that is quite serious, such as a diabetes or a kidney issue or other reasons that they may be doing that. It may be a sign that something's going on that you can catch early if you contact your vet. So things like urinary tract infections, bladder stones, kidney infections, things of that nature, they can all be determined usually with a quick couple of tests, and medication can be given. A lot of times I've run into situations with clients where they brought the cat in actually for euthanasia, and they've never researched the possibility of a urinary tract infection. We check the urine, it looks like there's an infection going on, we give them medication, and that cures the marking or the inappropriate elimination issue. Those are two of the easier things to deal with. Now we're going to deal with some things that are a little bit harder and sometimes take a little bit more patience on everybody's part. And the first thing we're going to talk about is the litter box itself. If you really think about it, litter boxes, they weren't created for cats. They were created for our comfort, not cats' comfort. That's why they're covered. That's why they have all these weird doohickeys to them. That's why they have all these weird odor-absorbing crystals and all this other stuff that really is foreign to cats, and cats really could care less about. It's really our comfort. So you really kind of want to think about what is the ultimate way of setting up a litter box for a cat. And there's a couple of things to remember, and a lot of this information comes actually from Dr. Norma Guy, who's a behaviorist at the Atlantic Veterinary College, where I went to vet school, and she was a tremendous resource in this, so I have to give her props in that. So first, looking at the box itself, you want usually something that's a little open where the cat can feel comfortable. If there's an area in the house where the cat spends 80% of their time, my cats in my apartment have kind of their own room, that's really the best place to put the litter boxes, because that's where they're going to feel most comfortable. Cats don't want to feel confined inside a covered litter box most of the time, and a lot of times if something bad happens, such as a loud noise happens or a kid bangs on the litter box when the cat's in there, all the cat's going to remember is that it went into a enclosed space trying to urinate or defecate, something happens, freaked them out, they're not going to go back in there, and sometimes that's why they'll urinate or defecate right outside the box. Another thing you want to remember is that, again, they want to have that sight line. They want to be able to see everything that's going on around them. They want to be able to feel comfortable when they're going, because it is kind of a vulnerable position for them in their prey, drive is telling them, in their prey awareness is, they don't want to be caught off guard, so they want to make sure that they feel comfortable. So sometimes hiding a litter box in the basement under the stairs, not the best location for it. If you just move the location, they'll do a little better. again, we were talking a little bit last time about arthritis in cats, and sometimes if they're older and you have, 3 litter boxes in the basement and the cat has to come up and down, say, 2 flights of stairs to use the litter box, it may just hurt too much for them to do that. So you want to take that into account. The cardinal rule with litter box numbers usually is 1 more litter box than you have cats. So if you have 3 cats, 4 litter boxes. However, you don't want to put all those 4 litter boxes sometimes in one spot, say the basement or something like that, for a couple of reasons. 1, for the arthritis that we've just mentioned. 2, a cat may just not feel comfortable going down into the basement. And 3, there are certain situations with multi-cat households, just like cats sometimes will food guard, where they won't let other cats eat or drink, they will litter guard as well. They may guard the litter box, they may prevent themselves from, or prevent others, from being able to use the litter box just because of aggression nature. So you want to be careful with that. Much as it pains people, really putting a litter box on every floor, sometimes in the living room, sometimes in a den area, really does help solve the problem. The cats just want certain areas to be able to go. So you want to take all of that stuff into account and try all these different things. You can try different litter substrates, and I'm sure most of you have tried different things, certain things that cats like or may not like. One thing I will mention that sometimes helps is you will have a cat that sometimes will prefer one substrate for urinating and one substrate for defecating. And what helps in those cases, if you get one of those little inflatable kiddie pools or sometimes little inflatable bathtub type things for infants, you can actually fill 1/2 of that, or try to keep half of it with litter and half of it just bare plastic. And you will find some cats that will defecate on the plastic and urinate in the litter, and that solves your problem. It's in a contained area. It's not the best because they don't cover it, but it definitely does work. So you definitely want to consider possibly doing that. As far as like the ultimate litter box, and this is why I am down in the storage room now of the Humane League, because I was looking for an example of this, is really not much of a litter box at all. The best and ultimate litter box for a cat actually is something like this, which I have here. This is actually the bottom part of a kind of like a critter cage that you would use for ferrets or guinea pigs or things like that. You notice this one actually was used for quite a while by ferrets, but look at all the characteristics it has. It's open, it's not covered, it's large. Cats like large areas to use in their litter boxes because they want to be able to stretch out to cover stuff. If you see a cat that's constantly scratching at the side of the litter box or the wall next to the litter box, they need more room to stretch out to really get in because they don't think they're covering their scent well enough. And that's really what you want to be able to be aware of. So you want to make sure that this type of litter box setup actually is the best. And you can get these things, just an underground storage container at Walmart or Kmart actually works very, very well from one of those things. So you certainly can try that. You don't have to go with all the huge fancy doodads and things like that are on litter boxes today. Again, those are designed for human comfort and enjoyment, really, rather than for the cat's comfort. The cat could care less if it's covered or has to walk up a ramp or stuff like that, and sometimes that may turn them off. So again, something like this actually makes a very, very good litter box. And usually if you fill it up about halfway, sometimes if you clean it every day, which you should be doing, because some cats are very finicky about that, once, sometimes even twice a day, you may run into a situation where you don't ever have to empty the litter box completely. You can just keep refilling it because they'll never really get down to the bottom and things like that. So that's kind of the talk part as far as it goes with litter boxes, placement, things like that. Since I think we're having time issues on the YouTube uploads, I'm going to stop it here on that section, and then we're going to do another section, part 3, which deals with kind of the medication, the stress issues, things like that, things that you can try. As I put through on all of these, this is not an effort to diagnose or treat any particular problem with your animal. Every pet is different, every case is unique, so you want to talk with your veterinarian, and especially with inappropriate elimination issues, you do want to talk with your veterinarian or a shelter staff, really try to gut this out, because 90% of these cases we can easily fix. It just takes a little bit of time. So I'll be back in a little bit with part 3, which kind of just deals with the medication issues of things. I'm going to go see if I can figure out where the hell I found this from, and kind of put it back to the cage that it goes to. So I'll see you in a bit.